It wasn't until, and I don't remember where I was, and I evidently, I filmed it and I didn't put it up anywhere. But, so I'm just going to start someplace. As you said, when Magic Johnson admitted that he had HIV, he was HIV positive, it changed everything. That was in 1991, of course. Before that, it was almost like people with HIV were lepers. It's just bizarre, just really bizarre. Okay, so where does HIV come from? Well, we're not sure. We're not exactly sure. Well, actually, we do think we know where it came from. In the 1950s, people in Africa eat what they call bushmeat. Bushmeat is any wild animal, including primates. So they eat monkeys, they eat chimpanzees, they eat gorillas. So they're pretty sure that it was a primate virus, that HIV was a primate virus. So it was in the primate world. Now normally, of course, people in the United States don't eat primates. We don't eat monkeys, we don't eat chimpanzees, we don't eat gorillas. But they do in Africa. One of the problems with consuming other humans, if we were cannibals, one of the problems is that you pass diseases back and forth, and that's not good. Well, primates are 99.1% of their DNA is our DNA. So this can be a problem, and in this case, of course, it is. The Ebola virus came from a primate virus as well. So here we have these horrible, horrible viruses, HIV and Ebola, and because they eat bushmeat, and the reason they eat bushmeat is because that's the only meat they have to eat. They don't have cows can't grow over there because of all the malaria. There's dengue fever over there, and it kills their cattle. So it's really hard for them to raise meat. So they eat bushmeat, and that's not everybody, of course, but they eat bushmeat. So the first individual to contract HIV was Gaetan Dugas, and that was back in the 1950s. And it didn't go anywhere. It just kind of stayed right there in Africa. It wandered back over into the rest of the world somehow, and it became a sexually transmitted infection. And the type of sexuality that was spreading it was gay sex, was male homosexual contact. And it seems to have gone from Central Africa to Haiti. Once upon a time in the 1970s, 1980s, Haiti was a gay destination for gays in the United States. And there were a lot of things going on that nobody knows about, that nobody talks about because it has to do with gay sex. But gay males were having lots and lots of group sex. It was really kind of interesting. So they were going down to Haiti, and they were having these gay sexual retreats in Haiti, and that's one of the things that happened. That somebody brought it back to the United States, and when they brought it back to the United States, because of the lifestyle, which wasn't the same as everybody else's lifestyle, of course, but gay males would do what they called they would go to bathhouses. And in the bathhouses, they would have multiple sex with multiple partners in a given night. So there was a lot of transfer of. If there were diseases, they were being transferred back and forth, and it was really kind of an ugly and interesting situation. And this has been going on for an extended time. The bathhouses in New York are very, very old. As a matter of fact, Bette Midler, if you know Bette Midler, she's the singer. She used to play in bathhouses, and her piano player was Barry Manilow, as interesting as that is, who now admits that he's gay, but for the longest time, of course, he didn't. Anyway, so we've got these bathhouses, and they've been around for For a century. They had just been these bathhouses where men went and only men went, and you could rent a room and have gay sex, and that was just the way it worked. In 1980, and of course I was working in medicine at this time. I got out of the service in '82. I was actually in Germany in 1980, but I was in Germany from 79 through '82. But in 1980, 55 men were diagnosed with a rare form of cancer. They didn't know what HIV was at this point. They had no idea how it was transmitted, that it even existed. But all of a sudden they started finding gay men with all these really strange diseases that they shouldn't have, that normally people don't have. The only individuals that are coming down with these diseases are people that are immunocompromised. But these are healthy men. These aren't bubble boys. These are healthy men, and here all of a sudden they were coming down with these really strange diseases. Kaposi sarcoma. Kaposi sarcoma is a cancer of the blood vessels and the mucous membranes in your body. We only saw this with bubble boys. Literally, we only saw it with the bubble boys. But here, all of a sudden, we've got 55 men, and they came down with the same disease. Now, doctors are not the brightest people in the world. If they see something different, they don't want to admit it. So it took them a while to figure out, hey, wait a minute, we've got gay males that are coming down with a really strange disease. I'm sorry that I insulted doctors. No, I'm not. In 1984, the HIV virus was isolated. So the problem was they didn't know they had a problem. So it continued to spread, and men were dying all over the place. Pneumocystis pneumonia, Kaposi sarcoma. They're getting these really odd diseases, but they all seem to be in gay males. Now, one of the other problems that we have is that we don't tie things together very well. Once upon a time, in a land far, far away in Germany, we had this uptick of gonorrhea on base. It was really kind of interesting. But we had the first person came in with gonorrhea, and all of a sudden another guy came in with gonorrhea, and all of a sudden another guy came in with gonorrhea. Oh, wait a minute. So, we've got like 5 or 6 cases, and we send them all to public health, and public health never ties anything together. Well, as it turned out, I was the one that figured it out. And the reason I figured it out was because I was the one that had to diagnose these bastards with gonorrhea. And the way you do it is that there's pus coming out of the end of their penises. So you have to take a spot of that pus, and you have to look at it and find out what kind of bacteria is in it. Well, after the 5th guy, I was getting kind of pissed off. And after the 5th guy, I started trying to figure out what was going on. And what I found out was that they were all in the same unit. They were all cops. So I went to public health and I said, hey, look, I've got 5, this is in a 2 or 3 week period. And I said, hey, look, I've got 5 cops that have gonorrhea. And they said, oh, that kind of stuff happens all the time. We said, we deploy to Greece, or they deploy to Crete, or they deploy someplace. And then they all come back with, gonorrhea. I said, I don't think that's it, dude. This is not right. There's something going on here. And he said, well, if we see another case, maybe we'll look into it. So, yeah, lo and behold, the next day, this 17-year-old kid comes in with gonorrhea. And lo and behold, he's a cop. He's got no stripes. He's a cop. So I carry it up to public health. And I tell them, hey, look, this is the 6th case. You said if there was one more case, you're going to look into it. And the only reason they looked into it was because he was underage. He was only 17. That's the only reason they looked into it. So they started, and of course, when somebody comes in with a sexually transmitted disease, public health has to ask them, well, who are your contacts? And most of these guys said, well, I went to Amsterdam and I had sex with this lady. And, geez, I only have sex with my wife, and with this one lady, and this other guy went to Paris and he had sex with somebody. Yeah, so all of a sudden, all these guys are coming in with gonorrhea. They're all coming in from different sources. But it's all in the same unit. So as it turns out, of course, we got number 7 and number 8 came in later on in the week, and they're all different guys. And we've got the youngest kid in the unit, and we got the first sergeant comes down with gonorrhea. He's an old fart. Embarrassed, ordering me around, telling me that he needs this result right away. I'm thinking, you bastard, you came in with gonorrhea and you want me to do it really, really, really fast because you got 7 stripes on you. Anyway, I did it, and I took it back up to public health. And they're getting the same story. And they kept telling me, well, we keep getting the same story. For spring break, not spring, they were on vacation. Memorial Day, they went to Paris, or they went to Rome, or they went to Amsterdam. Amsterdam's a really good place to pick up gonorrhea. Trying to pick it up. Anyway, okay. So eventually we got the 10th guy coming in, and we had one guy that came back again. Came back a second time. I know. So I said, hey, look, guys, there's something's going on here. What the hell's going on? And so eventually they looked into it, and one of the guys admitted that he had had sex with one of the female military people. And once that story came out, as soon as those other guys came back, guess what we asked them? Or guess what they asked them? I didn't have to ask them. They called them all back in and asked them, well, did you have sex with Airman Johnson? And I said, oh, yeah, we had. What was going on? She was taking them out on the flight line at night, and just for recreation, they were having sex. Well, as it turned out, she had gonorrhea, of course. Well, it took 10 guys coming in before public health asked the right question. Anyway, so we had a real interesting problem. We had Airman Johnson that needed to be shipped someplace else. So of course we shipped her off someplace else, and somebody else picked up her problem, which was having sex with anybody. She happened to be riding a truck with. Anyway. So what's my point? My point is a lot of times it's really hard for these people to tie things together. A lot of times they're not thinking globally, they're thinking individually. Well, where did this come from? They were actually more worried about the wives because 7 of these guys were married, and lo and behold, the wives were coming in positive as well. But as we're going to talk about in just a minute, gonorrhea is asymptomatic in women unless it advances. Anyway, okay. So it took them a long time to figure out what the hell was going on. Like I said, doctors don't like to talk to each other. They don't like to talk to public health. They don't like to talk to anybody. They're afraid that people will judge them, that they will say, oh, you did this incorrectly. And doctors don't like that at all. So it took 3 years. I mean, we had the first cases were coming in 1980. We had cases coming in from overseas all the time. And we were in denial as to the fact that this was potentially a really serious problem. In the beginning, it looked like it was just an infection that was gay males were having. Not just gay males, but white gay males. It was only the white gay males that seemed to have a problem. So we started looking for it. Now the problem was that the federal government, at the time Ronald Reagan was president of the United States, he was elected in 1980. He was going to balance the budget. I don't know if you remember Ronald Reagan balancing the budget, which never actually happened. But he didn't want to spend any money on medical research. As a matter of fact, he didn't want to spend any money on scientific research. So there was no money out there for us to do any research. And of course, we were the ones with these isolated pockets of individuals with the infection that we could have worked on. But of course it didn't happen. It didn't happen until Rock Hudson died of AIDS. And then finally Ronald Reagan agreed that AIDS was a problem that wasn't, because the religious right were saying that it was God's punishment for homosexuality, which is an abomination. So I'm right in the middle of all of this, mainly because I'm working in the laboratory and we're the ones that do all this work. Well, we do all the research. So it got really kind of interesting in the 1980s. Not only that, we had to change all the protocols in the hospital. Before that, we didn't wear gloves. Before that, we didn't wear masks. We never wore masks. I can remember doing an autopsy dressed with, like I'm dressed right now, with no mask, no gloves, chopping away, stuff squirting all over the place. Back then, if you had stuff on your outfit, then it looked like you were doing some work. And of course, everybody wants to look like they're doing some work. Anyway, so finally in 1984, we had people that were doing research. Finally, we discovered it in 1984, but the French discovered it in 1983. And what the French discovered was another virus. They discovered a virus called HTLV3. It's not exactly the same as the HIV virus. As it turns out, there's at least two viruses. There's probably a lot more. Or it was a mutation of the same virus. But they found HTLV3. And about the same time, we found HIV, or what we called HIV. And of course, at this point now, we can at least identify it. We know it's a virus. We didn't know exactly what it was. Actually, it's a retrovirus. In the late 1980s, once limited to white gay males, AIDS begins to threaten the general population. And this is because just because you're gay doesn't mean that you only have sex with men. You can have sex with it. You may be bisexual. And so you may have sex with not only males, but also females. And of course, as we discover later, most of the virus is located in semen or in vaginal fluid. As it turns out, in vaginal fluid is another problem. So we found it, so it starts to infect the general population. The reason it starts to infect the general population is because IV drug users are passing needles back and forth. Once upon a time, back in the 1980s, nobody cared. If you had a needle, that was good for the whole community, and everybody used the same needle until it got too dull to use, and then you went out and found another one. But that was in the 1980s. 1991, the 100,000th victim was discovered. In 1993, 2 years later, that number had doubled. By 1994, the number had doubled one more time. And there was a reason for this. And the reason was because we were being stupid. We weren't telling people, hey, look, we've got this HIV epidemic going on. Potentially, if you're an IV drug user, you're a gay male, or if you're a heterosexual female having sex with a male that may potentially be infected, you need to use a condom. And of course, nobody was using condoms back then. Now, of course, we give them away free in the high schools, don't we? Or do we don't do not do it. There are places that give away free condoms, however. 65 million people are, in 2006, 65 million people were infected with HIV. We've had 25 million deaths due to HIV. Okay, so we've got a situation here. It looks like if we look at this group of individuals, 34 million individuals are infected with HIV, 22.9 million are in sub-Saharan Africa. So why is that? Are there a lot of gay males in sub-Saharan Africa? Is that why there are so many?
Lack of education.
Lack of education? Lack of contraception, of course, it costs money. Condoms, they don't only give them away in high school, in the United States. Well, what else do we have here? Where are we? North America, 1.3 million people are infected with HIV. Adults and children newly infected, 58,000 a year. Where else do we have? Western Europe and Central Europe, 840,000. Where's the second most infected area? Latin America, 1.5 million. Eastern Europe and Central Asia, 1.5 million. Some places hardly have any, 54,000. Oceania, all around the Pacific Rim, 54,000. hardly any people. Caribbean, 200,000. South and Central and Southeast Asia, 4 million. Okay, the biggest problem that we have with HIV is that we have a lot of people that are sexually conservative. The more sexually conservative you are, the less likely you are to talk about sex. And this is the problem in, where am I? South and Southeast Asia. 4 million people. That's the problem in South and Southeast Asia. That's the problem in Sub-Saharan Africa. They don't want to talk about this stuff. They also, oh God, they have this idea that if a male comes down with HIV, if he has sex with a virgin, then he won't be infected anymore. That was the idea. I don't know, this is it. But I won't even explain to you the type of sex, but they have to have a certain type of sex. And it's relatively painful for the individual that he finds to have sex with. Strangely enough. Anyway, so that may be one of the reasons. We have the more male-dominant an area is, the more likely that HIV will spread fairly readily. That's what was going on in Sub-Saharan Africa. A male would come down, he would visit. As it turns out, they are so conservative that you can't have sex with your wife if she's menstruating. And you can't have sex with her if she's pregnant. So for 9 months, he's not having sex with his wife. This is one of the reasons why they have more than one wife. And sometimes he's got them all pregnant at the same time. So who does he have sex with if everybody's not, pregnant? Who does he have sex with? A prostitute, of course. And that's where the AIDS works. Unfortunately, and then he can demand sex from his wives, and then of course he infects them. There are whole villages where only children exist because all the parents have died of AIDS. Mother, father, everybody's gone. And so the only people that exist in these villages are the children. And this is relatively not that common, but we see it in Sub-Saharan Africa. Really kind of sad. So the reality is that the reason that they have so much HIV is because they're sexually conservative, and it's the same way in Southeast and South Asia. South Asia, we're talking about India. There is a road that goes across the top of India, it's like 3,000 miles long, and the truck drivers will stop and then have sex with somebody, with a prostitute, and then, of course, when they go home, they spread whatever they caught from the prostitute. Well, HIV is very common in that area, unfortunately. But the truck drivers, of course, because nobody wants to talk about it. Nobody is willing to talk about it. They're too conservative. It's non-traditional for them to talk about it. As stupid as that sounds. So they just keep spreading it. And nobody wants to talk about it. And nobody will admit this is what the problem is. So they just keep spreading it from one place to the other. As tragic as all that is, and I will get off my soapbox now. So the more sexually conservative they are, no, I'm going to tell you what these guys think. They think that if they have dry sex with the female, that they will get rid of the disease, but it has to be dry sex. Okay. If you understand what dry sex is. You don't understand what dry sex is. When a male has sex with a female, the female lubricates, and that's what allows him to have sex. That's what allows him to be able to penetrate the female. However, if she is not lubricated, then the only way he can penetrate is by forcing his penis into the vagina, and this is known as dry sex. And that's what he has to have in order for him to get rid of the HIV virus. He has to have dry sex with someone. And usually, if it's a virgin, she's probably underage. Well, what we would consider underage. There is no underage down there. But he'll have sex with a 12 or 13-year-old. Does that sound strange to you? It is. It's very strange. Anyway, so there's a lot of different sexual proclivities all over the world, and it's just really kind of strange. I didn't want to be as sexually conservative as those idiots in India that they drive their trucks, jump off the truck to have sex with this lady, and then they take it back and they infect their wives. It just seems kind of stupid to me. All we need to do is talk about it. Of course, I've been messing with this stuff for 50 years, so I'm a little less sensitive to it than maybe you guys are. Anyway, but you need to talk about it. Otherwise, you don't know how these idiots are spreading it from one place to the other. Imagine a diverse representative group of 1,000 people from around the world who died in 1 year. Those individuals, 163 would come from low-income countries where HIV and AIDS is the third leading cause of death in these low-income countries. Most of these countries are sub-Saharan, in sub-Saharan Africa. 677 from middle-income countries where HIV is the sixth leading cause of death. These are middle-income countries, East Asia, Eastern Europe, Western Asia, South Asia. These are middle-income countries. 159 would come from high-income countries like Europe or the United States. And HIV doesn't even crack the top 10 as far as wealthy countries are concerned. Take a look at what kills people in low-income countries. Number one is pneumonia. Number one is pneumonia. Number two is diarrhea. Number three is AIDS. Number four is ischemic heart disease, malaria, stroke, tuberculosis, prematurity, birth asphyxia, and trauma and neonatal infections. The bottom three of the top 10 have to do with infant mortality, as sad as that is. But these are in lower income countries without very much medical care. Okay, these are countries in sub-Saharan Africa mainly. So this is the middle-income countries, Western Europe, Southeast Asia. Ischemic heart disease is number one, stroke is number two, COPD is number three. If you've been listening to the news, Barbara Bush is about to die. That's the first Bush's wife. She's dying of COPD, and she is refusing treatment at this point. So she's going to, we'll hear about it in a couple of days. Anyway, she has COPD. Lower respiratory infections, pneumonia, diarrhea is number 5. Number 6 is HIV, traffic accidents, tuberculosis, diabetes mellitus, and hypertensive heart disease. That's what kills people in all of those other countries. This is Europe and the United States. And as you can see, HIV is nowhere on the list. And what do we die from? We die of ischemic heart disease, stroke, lung cancer, Alzheimer's disease. Now that's kind of interesting. We have Alzheimer's disease as number 4, but we didn't see Alzheimer's disease on any of the other lists, did we?
Because of age.
I'm sorry?
Is it because of age?
Yeah, we live longer. Sure. Yeah. Lower respiratory infections, this is pneumonia, COPD, there you go, colon and rectal cancer, diabetes mellitus, hypertension, and breast cancer is number 10. There you go. Interesting, isn't it? In the United States, AIDS has taken its greatest toll on young men, particularly African Americans and Hispanic Americans. Now, in the beginning, HIV was an infection for gay males. Most of the gay males that were dying were white. So why are all of a sudden our African American and Hispanics dying? African American and Hispanic males. But we have this huge influx of gay black and Hispanic males. Is that what's happening? They're coming to the United States for a good time? Is that what's happening? What's going on here?
Maybe like a combination of like stereotyping and like promiscuity.
Promiscuity, these guys like to have sex more than white guys do. White guys don't
Like
like,
kind of like a
wow,
stereotype.
2 or 3 times a year and that's it for me. I'm done. Whew. I already had sex twice this year.
Like pop culture, like I don't know, stereotype.
So you think that they're having more sex than anybody else?
Maybe more promiscuous.
Well, more promiscuous sex, so that's a possibility. It's not the reason, but that's interesting the way your brain works. It's really kind of interesting. No, it has to do with IV drug use. Yeah, there we go. An estimated 1.1 million people in the United States are living with HIV, and almost 1 in 5, 18%, are unaware of their infection. Okay. Remember, I showed you the timeline. 1984, we discovered what HIV was. So it took a long time for us to figure out a test so we could find out if somebody actually had HIV. Okay. October 19th, I can tell you exactly the day because it's my mother's birthday. October 19th, 1985. Playing soccer, I got rammed in the chest by the, I'm not going to use any swear words, by the goalie. And he was a Brit, and I didn't use any swear words again. I'm so proud of myself. Okay, so it was a British goalie, and the guy hit me with a rugby tackle in the chest. I was running full speed, and as you know from my biography that you all saw with the Warrior Red, I was a fairly fast runner. And so I'm running at full speed. This guy's not running that fast, but he's built like a shot put. He looks like a bowling ball, and he hits me right in the chest. And I was running at full speed. He knocked me back. I probably flew about 10 feet through the air. And he ruptured my spleen, so they took me into the hospital. And eventually they took me into the hospital. These are military doctors. And at first the military doctors thought I had bruised ribs. They thought I had broken ribs. Oh no, I look at the x-ray, it's not broken. But I see a little bruising in there. So at first they didn't diagnose me. So 26 hours later they finally took me to surgery and they took out my spleen. Well, when you take out a spleen, spleen is very highly vascularized, and that's one of the reasons why this is a problem. A lot of people who rupture their spleens will bleed to death in 25 to 40 minutes. I know, some of the doctors are going, "Oh my God, you're not dead." As if they were upset that I hadn't died when I was supposed to die. But they went in there and they went in, and of course it's highly vascularized, and I've got this chunk of organ that's no longer there, and all these blood vessels feeding into it are just like leaking into my thorax. That's what was supposed to have happened. But being the athletic fellow that I am, the bleeding stopped. The bleeding stopped, and so when they went in to do the surgery, they pulled all that stuff out. He said it looked like a hand grenade went off in my thorax. Anyway, so they pulled all this stuff out, all these blood clots out. And lo and behold, what do? I hemorrhage again. Of course I hemorrhaged again. They pulled the damn clot out, right? This is how stupid they are. So they're pulling all this stuff out, there's all these globs of blood and stuff. So they had to give me 6 units of blood. Well, this is in 1985. Well, they didn't discover how to test for AIDS until 1986. So I got 6 units of blood. Now, the probability that one of those units was tainted was fairly high because all of this blood came from, this is in Omaha, all this blood came from Lincoln. They'd run out of blood in Omaha, so they went to Lincoln to get blood. Well, guess where the gay community is? In Nebraska. It's not in Omaha, yeah. Okay. So, potentially I got a tainted unit of blood. It was possible. So every year I had to have my blood tested to find out if I had HIV. And we're going to talk more about that in just a second. That's the story. Okay, so we've seen the timeline. We know what's going on here. The increase in HIV among those over age 50 is partly due to advanced HIV therapy, which has increased life expectancy, of course. Back in the 1980s, people weren't living as long as they are today. Risk and symptoms of HIV and other STIs, sexually transmitted infections, may be masked in older people, and this is part of the problem. So if we look at who is contracting AIDS, as we can see, number one is white men who have sex with other men, MSMs. Black males are second, Hispanic males are third. Black heterosexual women are fourth, and black heterosexual men are fifth. And that, these two have to do with IV drug use. But as we can see, gay males are still contracting the disease more readily than anybody else. The rate of AIDS among women is increasing at a faster rate than that of men. In 2010, women accounted for an estimated 20% of new HIV infections. Most of these, 84%, were heterosexual contact. African American women and Latinas are disproportionately affected by HIV compared with women of other races and ethnicities. And that may have to do with the promiscuity that we were talking about before. Globally, girls and women are more likely to contract AIDS because women are often less able to protect themselves because they are economically and culturally subordinate to men. So the more conservative the area is, the less likely she is to say, nah, I don't think so, not tonight, honey. So it all depends. More of the virus is found in ejaculate. And of course, if males are having sex with females, then the female ends up with the ejaculate. And then, of course, there is more of the HIV virus in the ejaculate. Women progress to AIDS at a lower viral load than men do because of the size of men. Men are larger, therefore it takes more virus to infect the male than it does the female. And so none of these are any fair, I guess. None of them are any fair. So around the world, of course, the more conservative the culture, the more likely that a woman is going to come down with HIV. And of course, this is what we're seeing in Africa. 3 global patterns of HIV transmission. In North America and Western Europe, transmission is most often through gay men and IV drug users. It's almost exclusively that. We don't really see that much heterosexual spreading of the disease, and it's mainly because in other countries, especially where it is more conservative, men are hiding their homosexuality, and they're hiding their homosexuality by having sex with women. And not that they want to, but in North America and Western Europe, of course, it is acceptable to be gay. So the gay males are not having sex with women, they're only having sex with other gay males. Sub-Saharan Africa and Caribbean HIV/AIDS is most commonly found in heterosexuals, equally distributed among women and men. Of course, they're contracting the disease, and because of the conservative nature of their sexuality, the women cannot say no. So the men are contracting the disease, and then they are forcing their wives or girlfriends or whoever to have sex with them. Asia, Eastern Europe, North Africa, and some Pacific country HIV infection rates are still relatively low, and that's mainly because they are actually more conservative, and because they are more conservative sexually, of course, then the homosexuality is not an acceptable practice. Okay. And IV drug use is usually, drug use at all is not only unheard of, but it's also a capital offense. So if you're caught with drugs, they execute you. As interesting as that is. Globally, heterosexual transmission far outnumbers all other sources of HIV transmissions. And there's a reason why this is here. This statement is here. There's a reason why they talk about it in your book. And it's because when when the AIDS epidemic struck, there were conservatives in the United States that claimed that it was because of gay males. So they were being punished by God. Of course, if we look at HIV around the world, and of course those of us who were in the middle of this whole mess, were going, no, that doesn't make any sense. And of course it's really hard to argue with people when, it says right there on page 237, Johnson versus, no, I'm sorry. They're looking at the Bible and they're telling us what's going on. Jesus said that this is going to happen, on page whatever. Ethnic racial differences in rates of HIV transmission are thought to reflect sociocultural differences in drug use and the acceptance of homosexual and bisexual practices. The biggest problem is needle sharing, of course. Initial spread among U.S. drug users and gay men was in part due to the small, closed nature of these communities. As we were talking about the bathhouses in New York, this is a very closed community. And no one was invited in. Of course, if you weren't gay, you certainly wouldn't go to a bathhouse in New York City, but also the drug users are the same way. If you think about all your stoner friends when you're in high school, that was a fairly isolated group. And they really, I mean, they were the coolest people, so they certainly didn't invite uncool people to come and smoke dope with them. I mean, that's not the way it worked. So these have been relatively closed communities, and it's mostly for survival purposes. They did it because if you're gay, you didn't want other people to look down upon you. Therefore, you only interacted with other gay people. And it's the same way in the drug community, but it's more for protection in the drug community, because if the police find out, then they arrest everybody and everybody gets thrown in jail. So of course you're not going to, if somebody's uncool, you don't want them to be around. And I'll tell you right now, I'm probably the most uncool person in the whole wide world. I apologize for that. When I was in service, one of my jobs was collecting drug urines on people. And I always collected them. And no matter how much money they offered me, it didn't make any difference. I still collected their damn urine, and I didn't dilute it with water, and I could give a rat's ass whether they got caught or not. A rat's ass. Those sons of bitches. If they wanted to use drugs, then why in the world did they think that I should lose my job just because, you know, they were dirty? Of course, they thought you could test for marijuana, but we couldn't. We couldn't test for marijuana. And, I'll tell you what, of all the times, all the dangers that I was in the military, that was probably the most dangerous thing that happened. I had people that were going to kill me. Well, because I wouldn't change their urine, or I wouldn't put water in it, or I wouldn't let them put water in it. Or if I saw them put water in it, I would make them collect another specimen. You better not come out of the building tonight. You better not come out of the hospital tonight. You know, that kind of stuff. It was probably the most dangerous thing I did, was collect drug urines. The most dangerous place to collect drug urines is in Vietnam, where those guys, half of them were tainted, were dirty. Some of those guys, here's the problem. So you're shipping back to the States. Guess what is one of the last things you have to do? And you can't leave the country. You can't leave the combat area until you get a clean urine that comes back. Yeah, that was rough. That was really rough. HIV is present in high concentrate in the blood and the semen of seropositive persons. HIV can enter the body through any tear in the skin or mucous membrane, and this is one of the reasons why it is so widely spread in the gay community. Some of the sex that gay males have is fairly aggressive. And because of that, there is tearing of the mucous membrane, and therefore it is introduced into the other individual's body fairly readily. HIV is less easily transmitted than most other viruses. The reality is, if we had HIV right here on the table, if there was a drop of something that had HIV in it, and they put this table right here, it would die almost immediately because it's too cold. The table's too cold. So if, okay, let's say that somebody has HIV and they go to the bathroom, they sit on the toilet seat, they leave the HIV on the toilet seat, somebody comes right in behind them and sits down on that spot. What's the probability of that person contracting HIV? Zero, because it's too cold. HIV is extremely fastidious. It has to be spread through sexual contact. It has to be spread from 98.6 to 98.6. So the air kills it, the temperature kills it, everything kills it. Yeah, it's kind of bizarre. One of the problems that we did see with HIV, so we had all these gay males dying of the AIDS virus, or the HIV virus. One of the problems that we saw were the individuals that were suffering from hemophilia. When somebody has hemophilia, they have a clotting factor that's missing. And what you do for somebody with a missing clotting factor is that you give them platelets. You have to give them platelets. But If you draw a unit of my blood, of course you can't do that because I can't donate blood. Not because of the HIV virus, because I don't have a spleen. It puts nuclear material in my blood that normally isn't there. So if you look at my blood, and if you look at a red cell it actually has no nuclear material at all. It's not supposed to. But if you look at mine, some of mine do. And the reason that they do is because I don't have a spleen to clean it out of my red blood cells. So that's why I can't. It's not that I actually can't. But the fact that I got maybe tainted blood 30 years ago or something years ago. What were we talking about? Oh, hemophilia. Okay, so let's draw a unit of blood. We spin the blood down and we can take the platelets off, but we only get like a thimbleful of platelets out of each unit of blood. So in order to give the hemophiliac enough platelets, we have to spin down like 25 units of blood in order to get that. And it's not very much at all. I mean, it doesn't look like very much. Anyway, so we were doing that. We were spinning all this blood down. Of course, until 1986, we couldn't even test it for HIV. So we were giving all these hemophiliacs the AIDS virus, unfortunately. Yeah, I know, it's really kind of tragic. So we lost a lot of hemophiliacs that way. We lost just a ton of them, unfortunately. Children are usually infected through the mother's blood that passes through the placenta during labor and birth. As long as the baby is in the womb and as long as there is no break in the placenta, then the baby doesn't come in contact with the HIV virus. The baby is able to protect itself from the mother's blood until they give birth. And of course, if they know that the mother is HIV positive, then they can do a cesarean birth, and it's a relatively sterile, clean birth. They just make those incisions and they pull the baby out, and the baby actually never comes in contact with its own mother's blood. But if it is a normal vaginal birth, of course, the probability of being contaminated with blood is relatively high. There's a very low risk of accidental infection. AIDS is not transmitted by donating blood. Exposure to airborne particles, food or insect bites, shaking hands, drinking from the same cup, sharing a work or home environment, the probability, remember it's an extremely fastidious virus. It's actually a retrovirus. It's very, very fastidious, and air kills it, temperature kills, everything kills this damn thing, except of course, if you've got it in your semen or your vaginal fluid, I mean it'll stay alive there. People infected with other STIs, sexually transmitted infections, are up to 5 times more likely to acquire HIV infection if exposed to the virus. HIV-infected individuals are also more likely to transmit HIV to others sexually if they are also infected with another STI, and that's because they are immunocompromised. STIs increase the susceptibility to HIV, and that's probably because the individuals are immunocompromised. Genital ulcers cause lesions in the genital tract lining, and of course that makes them more susceptible to HIV. Inflammation increases concentration of CD4+, and other cells serve as targets for HIV, and that is where it comes from. So we're going to talk about other sexually transmitted infections. I've got tons and tons of stories. I'll try to keep it to a low roar as far as all these infections are concerned. Remember, I've been working in the field for a really long time, and of course military members contract these things on a fairly regular basis, unfortunately. I don't know why they think they have to have sex with women that have all these infections, but it just happens. I told you about the guy last time, the guy that he came in 1 week with gonorrhea. And so we treated him and we sent him out. He came back the next week with gonorrhea. Same gonorrhea too. And we treated him and sent him out. And the 3rd week when he came back, we of course told him that if he contracted gonorrhea, he's getting it from the same source. Same lady. We told him if he did, he was destroying military property. And we ordered him not to go out and get infected again. And lo and behold, of course, that's when he came in with gonorrhea again. And we took a strike. I didn't take a strike. I didn't have anything to do with that. But we took a strike from this stupid bastard. I mean, how stupid do you have to be to keep contracting the same disease from the same lady? We even gave him enough pills to give to her so that he...
Wow.
I know. You know what he did with them? Instead of giving them to her, he kept them for the next week, just in case he came down with the same stuff. Guys used to say that they had acne. Because if they had acne, we would give them Accutane. And Accutane they used as a prophylactic against gonorrhea. So they would take Accutane, pretending that they had acne, and that would keep them from getting gonorrhea. Stupid people. Okay, so we're talking about genital warts. It's caused by the human papillomavirus. Genital warts, as we know now, also are the precursors for a papillomavirus infection in the genital area. Is a precursor for cervical cancer. We know that now. Genital warts are passed through genital contact, most often during vaginal and anal sex. It also may be passed on through oral sex, even when the infected person has no signs or symptoms. So if somebody has the human papillomavirus, it doesn't mean that you have to have an active wart. It can be in your system, strangely enough. So there are individuals out there that are spreading this stuff and they have no clue. This is the #1 sexually transmitted infection. It's the most common. Highest prevalence rates for HPV infection found among women aged 20 to 24. Many are symptom-free. Some develop into serious health problems, such as genital warts and certain types of cancers, and that type of cancer, cervical cancer. We had a 17-year-old that came in one time with genital warts. And the way you treat genital warts is you freeze them off. You have to freeze them. So you use liquid nitrogen to freeze them off. Evidently, it's pretty uncomfortable because every time we do it, and of course, they're all over the place. So this 17-year-old came in, and it was like 10 days later, his brother came in with genital warts. 15-year-old brother came in with genital warts. And so, of course, we sent it all down to public health, and guess where it came from? A 41-year-old neighbor. And when the 17-year-old found out that the 15 had been messing with his girlfriend, oh man, we treated the 17-year-old for a broken hand because he punched his brother, and he broke his brother's orbital bone. His bone around his eye. So we had to treat them both twice because of genital warts. This is in Oklahoma. Only in Oklahoma you're going to see that kind of thing. Chlamydia is the most common STD. Chlamydia, it's caused by the bacteria Chlamydia trachomatis, which commonly infects your throat, your genital area, and your anal area. You can potentially have this bacteria in there, and it's not causing any problems. When we were looking for gonorrhea, we used to find this all the time, and we didn't treat it. We called it nonspecific urethritis is what we called it. So we didn't even treat chlamydia. Now, of course, now we know that it can cause a lot of really strange problems. It's spread through semen and vaginal fluid from any unprotected sex. It responds well to antibiotics, though there are resistant strains of this stuff. There's actually 3 different bacteria. Chlamydia is just one of them. 3 different bacteria that cause a very similar infection. In women, it's usually asymptomatic. They don't even know they've got it. Some women may experience pain during sex or urination. Men usually have a clear discharge and a vague itchy feeling, with painful urination. If women are untreated, they may develop pelvic inflammatory disease, which may cause ectopic pregnancy and later on arthritis. So this is something that they have to be careful of. If the bacteria is viable during vaginal delivery, it may infect the eyes of the infant and cause blindness. And for that reason, we check for this every time she comes in for a checkup. Especially in the military, where you've got guys coming and going all the time. We used to check if a wife was pregnant, we checked back whatever type of bacteria was in her vaginal area, but we also checked for gonorrhea because that can cause really serious problems with the babies. Untreated men may become unfertile, develop eye infections or arthritis. It's really kind of interesting. These guys will develop, they'll have pink eye all the time. They'll have conjunctivitis all the time. It's because they're touching their penises and touching their eyes, back and forth and back and forth. So they'll get conjunctivitis, chlamydial conjunctivitis, as interesting as that is. Sorry that I don't have any good stories. Neisseria gonorrhea. I've got tons of stories about gonorrhea. This bacteria can infect your genitals, your anus, or your throat. We had an opera singer that came in one time with gonorrhea of the throat. That was kind of interesting. She was having oral sex. She thought that cleared her vocal cords or something. It was really kind of bizarre. It is spread through vaginal fluid or semen during unprotected sex. Responds to antibiotics, though there have been resistant strains of gonorrhea. We had a resistant strain in Vietnam. So if you can't treat it, if you don't have any antibiotic to treat it, what do you do with those guys that come down with penicillin-resistant gonorrhea? What are you going to do with them? Send them home? We can't. What do you do with them? What would you do with them? You can't send them home. You can't send the stuff back to the States. What are you going to do with them?
I just keep them there.
Keep them there? That's what we did. We didn't have a choice. Did we? MIA, missing in action. We had to send them to the Philippines. Put them on an island. What else are you going to do? And the whole time, of course, we're trying to find an antibiotic to treat these guys.
I want to go to the Philippines. That's all I want to say.
They were on an island, and we had them guarded by Navy SEALs.
Navy SEALs.
We didn't want them to escape. None of them were there. None. The ones that didn't die, we finally found an antibiotic, broad-spectrum antibiotics that actually worked in this stuff. I know. But we were afraid to use it. This is how interesting this gets. Because if you start treating this stuff with an antibiotic, eventually the bacteria will develop a tolerance to that antibiotic. So we were afraid to actually treat it, but we did. We treated it. And the ones that were left, we sent home. Don't worry, we sent them home. Oh, man. Okay, so what does it look like? Most women are asymptomatic, though some may have vaginal discharge or painful urination. Usually not. Usually they're completely asymptomatic, so they have no clue that they've got it. If they're pregnant, now we got a problem. Now we got a really serious problem, because if that baby is born with an active case of gonorrhea, and the woman has an active case of gonorrhea, the baby may potentially die, or if it gets in the baby's eyes, the baby will go blind. So we really can't allow that to happen. We don't want to allow that to happen. So we have to check the woman every time we see her, which is every month until the 9th month. And in the 9th month, just before delivery, we will check her again. Now, the problem is that it takes 2 days to grow the bacteria. So if she comes in and she needs to deliver today, then we don't know if she's got it or not. And sometimes we would do a cesarean section, just because we didn't have any way of checking it. But that was in the military, where it was relatively common. We saw it way too much, and it was mostly from guys going overseas and then coming back. That's usually where the problem was. And sometimes they would send them back like 2 or 3 days before the baby was born, and that's not a good idea either. But I mean, that's what happened. I know. It sounds mean, but who's the most important person here? This guy getting off, or this baby being born with eyeballs that actually work, or being alive? I know, it's ugly, but you know, what are you gonna do? Most women are asymptomatic. Men develop a yellow-green discharge, painful urination, and pain in the penis. Untreated women may develop pelvic inflammatory disease or become sterile due to scarring. You can get pelvic inflammatory disease from any urinary tract infection or any vaginal infection. Untreated men become sterile, have swollen testes, and they have urinary problems. I had a boss who, when he was in Vietnam, he was as dumb as that guy I was talking about before. He contracted gonorrhea 7 times. And of course he used to brag about it until he decided he wanted to reproduce. And when he wanted to reproduce, he found out that he was sterile. And he was sterile because all the scarring that was done on his urethra when he had those 7 cases of gonorrhea. And he had a similar situation to this other guy. He kept contracting gonorrhea, and they told him not to get it again. And so the next time he got it, he waited and waited and waited and waited, and by that time, of course, it had already done a lot of damage to his urethra. But of course, and he got in trouble. He lost his strike because of it, because they ordered him not to contract gonorrhea again. If untreated, it can become septicemic, and it can infect the heart, the brain, the liver, and it can cause arthritis. We had a lady that came in with septicemic gonorrhea. Boy, we fought with trying to save that lady for days. We fed her all kinds of antibiotics, nothing worked. We couldn't bring her it's septicemia, so it's an infection of the blood. So we were trying to bring her fever down, but we couldn't do it. I mean, we did everything we could. We had her in an air-conditioned room. It was in November. We had her in an air-conditioned room. She was naked. And we were doing everything we could to keep her from having too high a fever. She died. I know, it was sad. Trichomonas vaginalis, trichomoniasis is caused by an amoeba, the Trichomonas vaginalis amoeba. It causes a great deal of trouble in the female vagina, but is basically asymptomatic in the male urethra. So the male doesn't know he's got it, and she knows she's got it right away. We treat it with Flagyl. Flagyl is it's not an antibiotic, it's an anti-amoeboid. So it kills single cell animals. And in this case, that's what trichomonas is. It's asymptomatic in males. In females, it causes abdominal pains, unusual vaginal discharge. It's frothy. It looks like foam coming out of the young lady. It's really kind of interesting. It causes vulval and vaginal redness. It can cause irritation, burning, or itching of the penis for the male, but only after he has intercourse with the female. Painful urination in both the males and the females. It's painful intercourse for both the males and females, or it can be. She really doesn't want to have sex at this point because she's a mess. If she is pregnant, it can cause premature delivery, and of course it makes her more susceptible to HIV. We had a case where sorry. Okay, so I had this girlfriend, okay? She looked like Barbara Eden. So if you know about Barbara Eden, except she had dark brown hair. She was really, really attractive. The guys were just, if she walked past, the guys just started breathing for her. Panting like puppies. It was really kind of sad. She was a very attractive woman. She told me this story about when she was, she's from Chillicothe, Ohio, and she was engaged to this guy. This lady had a drawer full of engagement rings. Everybody wanted to marry her. She was gorgeous. Everybody wanted to marry her, and this guy wanted to marry her too. So what happened was, so she came down with trichomonas, and she got really. She's a nurse. So she got really upset with this guy, and she took all of their bedclothes and their mattress, and she took them out into parking lot. They were living in an apartment, and she set it on fire. And so and then she takes off for Arizona. She takes off for Phoenix. And so she's driving from Chillicothe, Ohio to Phoenix, Arizona. She's just burned almost everything in the house. Well, all the bedding and all the mattresses and whatnot. So she gets to Phoenix, and she stopped at a stoplight, and all of a sudden, bam, somebody hits her from behind. It's this guy. He's followed her all the way from Chillicothe, Ohio to Phoenix. I don't know how it went, probably knew where she was going anyway. He found her car, and when he saw it, he just rammed it. And so, he hits her from behind, and she hits her nose on the steering wheel, and she splits her nose, wide open. I mean, it spread it on both sides. I know, spread it right down to the cartilage. It was a mess. And so the only flaw in this lady was this little bitty scar. Some plastic surgeon really put it together really well. But she had this little bitty tiny scar on the end of her nose, which made it cuter. I mean, made it just that much more attractive. I know. Anyway, she had trichomonas. And it made her so pissed off that she burned all the bedding in the house. And then the guy followed her all the way to Phoenix. Who does that? I've got another story about her in just a second. Genital herpes is caused by varicella zoster virus, the herpes simplex virus. It causes blisters in the affected area, which can include genital area, the anus, or sometimes the mouth. It's spread through unprotected sex or skin-to-skin contact. It's treated with an antiviral medication, but there is no known cure for it. You can't cure it. If you ever contract it, you got it forever. And eventually, of course, it also causes chickenpox, but it also causes shingles. So if you have it, then potentially it'll come back and bite you, probably, in the side. That's usually where you get shingles anyway. It hides in your nerve endings in your back, and of course it does reoccur. So you never get rid of it. It causes fatigue, fever, painful blisters. That's what a fever blister is, or what do we call it? Cold sore. That's what a cold sore is. Itching, ulceration, scarring in severe cases. There are two different types of herpes. Well, actually, there's like a dozen different types of herpes virus. But the two that most people know about are the cold sores, which are oral, and then genital herpes, which is a totally different simplex. So if you've got one, it doesn't mean you've got the other. Anyway, genital herpes. Why do I have another story about Sheila? Oh, I was thinking, okay, maybe I don't have another story about Sheila. Who was never my girlfriend, by the way. I wanted her to be my girlfriend, but she was never my girlfriend. She could have contracted every disease you can imagine, and it wouldn't have made any difference. She lives in Fort Lauderdale, Florida, and my daughter used to live in Boca Raton, and they have the same telephone number, Fort Lauderdale, Boca Raton. So I used to look her up every time I went down to visit my daughter. She's still, she's still there, and she's still not married.
Tell the whole thing, Bruce.
I'm sorry?
Just tell the whole thing.
That's about it. One summer.
Maybe we got to kill the girlfriend.
One summer I was going to go down and visit her. She had a boyfriend at the time, and he was in the Navy, and he came back early, so I couldn't go.
Oh my God.
Yeah.
I wasn't married, come on. It's always a possibility. Anyway.
Hey, is that going to be on the exam?
You get an F for the day, John. Okay. So what are we doing? We've got HIV virus. HIV infects mostly lymph tissues. HIV infects and destroys a type of lymphocyte called the T cell. The retrovirus is a virus that copies its genetic information onto the DNA of the host cell by breaking into the lymphocyte with reverse transferase and replacing a portion of the DNA from the host with its own genetic material in the form of RNA. So it replaces your DNA with its RNA. Once that happens, that cell, that T cell, can no longer identify alien structures in the body. So it destroys this T cell as a functioning cell. But it's still infected with the HIV virus. So anytime you spread anything that has blood in it, or has T cells in it, like semen or blood, potentially it's infected. So you've got to be very careful if you have a positive case of HIV. Okay, it's up here somewhere. Genome is all of the DNA information from an organism. DNA of infected lymphocyte remains dormant until activated against another virus or foreign agent, at which point it divides and it replicates. Now this is a problem with HIV. You don't know whether it's there or not there. If there isn't enough of it for something to detect, then of course you're not going to detect it, but it can still stay dormant in your system for an extended length of time. HIV infection may be carried for many years in the unsuspecting victim before symptoms appear. Unfortunately, this long dormant period often means that carriers who are unaware of their infection may spread the HIV unwittingly. So how long are we talking about? In the beginning, they didn't know. Remember, it didn't show itself until 1980. Now, normally, if we have a virus like the cold virus, how long do you keep it in your system? A week, 10 days? Not even that long, actually, yeah. Yeah, you're going to be sick for about a week. But HIV virus, no, it stays in there for an extended length of time. So we didn't even know that it was there until 1980. They didn't discover that it was a virus until 1984. They didn't discover a test for it until 1986. So here we have all these individuals that have come in contact, potentially they come in contact with the HIV virus, and people are telling them, well, how long is this going to last? Well, they didn't know. In the beginning, they didn't know. They had no idea. So in the beginning, they said after a year, if you haven't contracted AIDS after a year, then you're okay. And then, of course, we had people that had contracted it 2 years before, and 3 years before, and 4 years before, and of course, it's over a matter of time. And they are coming down with AIDS, so now they're saying, no, you're not safe until about 5 years, if you haven't contracted it in 5 years. But we have other individuals, as time goes by, of course, from 1980 until 1990, we have individuals that have had it, contracted it after 8 years, after 9 years, and now after 10 years. So now the window is about 10 years. Okay, so I had my ruptured spleen in 1985, had the surgery in 1985, so that means if I didn't contract AIDS by 1995, I'm all clear, is that correct? Well, they're still watching the window. I haven't, of course I don't have AIDS, but it has been 85, that's 15 plus 18 is what, 33 years. Okay, it was 33 years ago that I potentially contracted the HIV virus, and I'm still okay. But am I still okay? And the answer is probably yes. That's the way they see it anyway. The interesting thing about the HIV virus, right after you contract it, your immune system pretty much knocks it all out. But if it doesn't knock all of it out, then you're probably going to be asymptomatic in the very beginning. But as it starts to replicate, it starts building up in your system. Now, suddenly you're going to get sick. These are years. This is 1 year, 2 years, 3 years, 4 years, 5 years, 6 years, 7 years, 8 years, 9 years, 10 years. As you can see, they assume that if you haven't contracted it within 10 years, that you're not going to have the HIV virus. But normally, within the first year, you do contract the HIV virus. It will manifest itself in one way or another. For what? This is 5 years, you're going to be in the latency period. The T cell concentration falls and HIV concentration rises, accompanied by symptoms such as swollen lymph nodes. So if you've had swollen lymph nodes after your potential infection, then there is a possibility that you have HIV. swollen lymph nodes. You also are immunocompromised. Remember, it's affecting T cells. So you come down with just about everything that walks through the door. You get, if everybody's got a cold, you get the cold. If everybody's got the flu, you've got the flu. If everybody's got some strange stomach virus, you've got some strange stomach virus because you're immunocompromised. Okay, so all of this has to take place in order for them to assume or to think that possibly you have the HIV virus. And of course, now we can test it. And I've been tested multiple times, and it has never been positive. Stage 3, as T cells are reduced further, immune function is impaired, and opportunistic infections occur. The opportunistic infections are usually those really strange infections that we only see in people that are immunocompromised. And now we know for sure that you've got full-blown AIDS. And of course, stage 4 is finally almost all natural immunity is lost and full-blown AIDS occurs, and now we need to put you in a bubble so that maybe potentially you can be saved. However, we do have medications now, and we can start treating you as soon as we detect the HIV virus. We can start treating you after 2 or 3 years. AIDS affects many body systems, including the central nervous system. In about half of the AIDS patients, HIV will attack the brain cells, and they will have cognitive problems, forgetfulness, inability to concentrate, general confusion, language impairment. They look like they have dementia. And actually, that's what they call it. They call it AIDS dementia complex. The syndrome is involved in memory loss, confusion, and personality changes. The personality changes are not pleasant. The personality that you acquire is not a happy person. It is somebody that is grouchy, that you're very easily irritated. You're not a whole lot of fun to be with. So, not a good stage. Average time from HIV infection to AIDS is about 10 years, but it can be a matter of months, depending on whether you're immunocompromised. Remember, we talked about those other sexually transmitted infections. If you've ever had another sexually transmitted infection, or if you have an active sexually transmitted infection, the probability that HIV will manifest itself in a matter of months is very high, because sexually transmitted infections make you immunocompromised, in which case, of course, it's going to replicate much, much more rapidly. The period from diagnosis of AIDS until death may be as short as several months or as long as 5 years. And obviously, I don't have either HIV or AIDS. I never get sick. I know, kind of boring. Immunocompetence, AIDS progresses more slowly among those with strong immune systems. Genetic vulnerability is where some people inherit a gene that may convey AIDS immunity. About 1% of the people in Western Europe, or people of Western European heritage, are immune to HIV infection. About 1%. We don't know who those people are.
It's time.
I'm sorry, is it time? It's time. So let's stop right here and we'll pick this up next time. I was having such a good